Well, parents are continuing to get their kids ready to go back to the classroom, and many things on their agendas include those dental visits, and some may have to consider sealants, while others may be looking into getting their kids' teeth whitened. To clear up some of the confusion for us this morning, we have asked Dr. Brook Mahan with Brookside Dental to join us to discuss some of those options for us. Good morning. Thanks for being here.
Good morning.
All right, so first of all, sealants. We've heard about those, and of course they protect your teeth from cavities. But a lot of parents, I mean, we've even run a report here that says sometimes they can be dangerous. Talk about that.
Well, they have so many benefits that the dangers are really not anything that should affect the decision to get sealants. The dangers come in, I've had concerns with BPA, which is a product released in plastics. Right. Every dental sealant that we have at our office are BPA free, and most manufacturers now are BPA free.
Are they expensive to get them?
No, they're very inexpensive, especially considering if you don't, the expenses you can incur with tooth decay. Mm-hmm. Much better to prevent. Prevention's the key.
And is there an age limit for that, or what do you recommend?
The adult permanent teeth, that's what we like to seal. I do some sealants on some children and on primary teeth, but they don't tend to hold up like the enamel of a secondary tooth. Usually around age 6, we will seal their teeth as they first erupt, just to give them the most protection.
So this is an example, and you can see it's a lot smoother there on the right, and that's right. With the sealant on top of it.
That is with the sealant. It just fills in the grooves and protects the teeth from, you know, all those things like Oreos and gummies that your kids get at school. They're going to eat them anyway.
Maybe if they're not the best brushes.
Right. Now, there are a couple of dangers as far as just if they're done correctly. If I've had several instances that I've flicked off some sealants that that's important that's why you should come in and get your children's teeth checked at least twice a year. Mm-hmm. Because if a loose sealant's worse than, I would rather not have a sealant. Well, if you've got a loose sealant there, you're harboring bacteria under there, and you don't really know it's loose until it flicks off. Gotcha. And so to come in and get them checked at least twice a year, we're able to maintain the integrity of the sealant.
Okay, real quickly, I want to talk to you about kids. I know a lot of younger kids, even my kids, they say, my teeth aren't white enough. But how old is, or how young is too young to get their teeth white? And then you were telling me before, they kind of can get whiter as they get older, right?
They do. The enamel, well, that has to do with our brushing skills as we get older as well, and how we take care of our hygiene. Sure. The younger the patient is, the more sensitive the teeth are. The nerve supply to the tooth is, the chamber's a lot larger when you're younger, and as we get older and use our teeth and wear and tear on our teeth, it shrinks, so our teeth become less sensitive. Mm-hmm. So the younger you expose them to this bleaching, the more sensitivity they're going to have. It's all reversible. Okay. All sensitivity will go on. It just can be prolonged the younger they are.
Okay. So what would you recommend? How old is the right age?
18 is a good age. I have done some 16s and some 14-year-olds, both knowing what they were getting into, right. And everything was just as we explained to them. So it did turn out fine. It's just not maybe the most pleasant experience for them.
All right, now in the doctor's office or dentist's office, compared to the white strips that you can get over the counter, what's the difference there?
White strips are limited a little. You have to have some pretty straight, ideal situation to maintain the strips and keep them in place, and they have to have contact with the teeth for the bleach to work. So in-office bleach is great. We put the bleach where we want the bleach. It stays where we want it. With the zoom, as in our office, the laser is more effective. But we also do take-home bleach trays that give the patient more at-home control, and I myself, that's what I use. I like to have control and maybe not get as white as some other people, and just kind of keep things bright from time to time.
So don't get iridescent. Now we were looking at that picture there. How many treatments was that?
That was probably a zoom, one in-office treatment, between 45 minutes to an hour, given the preparation time.
And the price for that?
The price for that is $325 to $350, depending on the products we use.
Okay, but get it done at one time. All right, real quickly, parents going back to school, what are some of the common, or parents, the kids going back to school, parents bringing them in, what are some of the common things that you're seeing, common problems with kids?
I think one of the most common things I see is education about how to take care of your children's teeth and parent involvement with their kids. We get so busy and hectic in our schedules. And
go brush your teeth. We don't.
And we say go brush your teeth, and in my opinion, a child's not old enough to brush their teeth by themselves until they can effortlessly tie their shoes. And even then, you should say, let me check, let me see, because they don't always get all the Oreos out of their teeth.
Right. Okay. Perfect. Great advice. Thanks so much for coming on this morning. Appreciate it.
Thank you.